He told me straight up what it was and told me that my chances of making it for the next couple weeks was slim.
Coming up today, a surprise cancer diagnosis, but not without hope. How this Olympic coach persevered. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Veronica Malone's doctor told her to get her affairs in order. She had cancer and it was already advanced. But 6 years later, she is surrounded by family, driven by gratitude, and counting each day as a gift.
And these are all just different coaching awards.
Veronica Malone breeds perseverance.
These are top 20 in the world. I was renowned for being one of the toughest coaches we had in this country. But I was fair. This was from Paraguay. I was supposed to help shape their swimming program, but also their Olympic effort, which I did.
Through many decades, Veronica was considered one of the top swim coaches in the nation.
This is the U.S. Swimming Award, and probably the highest award I've ever won.
She trained 7 athletes for the Olympics. She produced 4 gold medalists, including Shannon Freeland.
She gave me her Olympic flag. Each athlete gets one of these.
But retirement gave her more time with her 3 daughters and her grandkids. Until one day she noticed something was off. She decided to get it checked out.
I thought I really just had spinal cord problems.
Veronica thought it was just years of wear and tear on a coach's body. She was wrong. She was referred to the University of Kansas Cancer Center, where Dr. Joseph McGurk diagnosed her with acute myeloid leukemia, a rare and aggressive form of blood cancer.
It was kind of shocking because he first told me I had AML, and he explains it, acute myeloid leukemia. I said, well, what's the prognosis? He said, it's not real good, you're pretty advanced. And so he suggested I make sure I have all my affairs in order.
Her situation was dire. But then Veronica remembered just how hard she used to push her athletes.
Their battle to get toward their dreams saved me some nights because I just wanted to die. There were a few nights that I just said, I hope I don't wake up tomorrow.
Dr. McGurk started Veronica on aggressive chemo and told her that in order to survive, she'd need a bone marrow transplant.
My goal was to make it to Thanksgiving, and we had a 50th wedding anniversary coming up, and I wanted to be here for it.
Veronica got her bone marrow transplant, and she got that Thanksgiving.
If I could just see one more Thanksgiving, one more Christmas, I thank God for that. Now I've seen 3 of each.
Her journey hasn't been without setbacks and complications, but Veronica knows how lucky she's been.
I've always lived forward, not backwards, so I don't spend a lot of time looking behind what I accomplished. It was about what was next to do.
And what it's like to truly be alive. And Coach Veronica Malone is here with us now alongside Dr. Joseph McGurk. Dr. McGurk is the Division Director of Hematologic Malignancies and Cellular Therapeutics, as well as the Medical Director for Blood and Marrow Transplants here at the University of Kansas Cancer Center. Also, a crucial part of his team is Dr. Elizabeth Monks, an oncopsychologist working exclusively with blood cancer patients. It's just so great to have all 3 of you sitting here with us today. How are you?
Doing very well. Thank you for having us.
How great is it to be here with Coach?
Oh, it's miraculous actually, and always fun to be with Coach Malone, and just wonderful to hear this compelling story told.
Dr. Monks, how nice is it to be here with Coach Malone?
It's fantastic. Watching that story is incredible, and I think just a really great representation of what so many of our patients go through and their incredible resilience and grit.
Veronica, take us back really to the beginning. You mentioned feeling something was wrong with your spine. What did that feel like, and how was it progressing over time?
Well, in the last year and a half before I had the crash and boom, which you saw the face, was I was down to, if I could walk 20 I wasn't using any canes or walkers. So I could barely walk 20 steps. So like when I would go to a youth soccer game or softball game or baseball game, I remember the last one I went to before this diagnosis. I could barely get into the park to go pick up my granddaughter from her softball game. And that was my job that day. And I had to sit down on rocks all the way in at Blue Valley Rec Complex. And I kind of knew that. I'd gotten to the stage of my life where I thought about everything, how far I was going to go, how close could I park to a door, because how many steps would it take to get in. And I had gone in for finally had committed to getting it looked at. I went to the orthopedic hospital because I thought I had a spinal problem and a neck problem. I had no idea the magnitude of it. And so they, only through my connections, because I had dealt with a lot of the orthopedics there through my journey as a coach, and I'd had 2 hip replacements, and so and a shoulder reconstruction, and I went to where I knew, but I didn't get an appointment, but I got an urgent care appointment, which one of the top physician assistants looked at me and said, we need to get an MRI right away. So they got me in for an MRI that night, and they said, well, you have spinal stenosis, cervical stenosis. So I thought I had a diagnosis. And went home, and I said, what's the next step? He said, well, we're going to try to get you in to see this specific doctor. And that was like 8-10 weeks later, and I was going, I'm miserable. Sitting down, standing up, walking very far. But I accepted it and went home, and when I finally got to that appointment that morning, that's where my story really began.
Because that's where you took that fall.
Yeah, I stood up. I was at the orthopedic hospital in the waiting room, got up. And again, still not using canes or anything, because I'm stubborn, even though my wife had told me, you need to get a cane. You need stability. And I said, she had gone with me. She never goes to doctor's appointments with me. So got up that morning from the waiting room, walked back to the consultation room, leaned over to put my purse down, and that was a blitz across the consultation room into a marble windowsill and smashed my head and splattered on the floor. And from there, I was, obviously it's a head wound, so you're bleeding profusely, and and I said, well, what do we, because I was conscious, I said, what do we do now? And he said, well, because I figured I'm at a hospital, they'll just patch me back up, and I want to meet with this doctor over this spinal problem.
And we have a picture that you actually shared of this bump on your head. This is when they took you to the hospital.
That's, I think, a few days after I got admitted to KU, yes. And I had black eyes for a couple months after that. They didn't go away, and but they said, well, we're going to call EMT, and they took me to St. Luke's South, which is where I really began the journey. And the medics, I guess, took a blood sample during my ride over and immediately sent it to their lab, and they come back in, they said, do you know you have leukemia? And I said, no. And he said, well, we'd like to do a bone marrow biopsy. And I said, well, first explain what that is. And he said, well, we're going to kind of drill into your lower back and into your spine area, and we're going to extract some stuff. And I said, well, okay, that's fine. And I've got a pretty good threshold of pain, and couldn't feel any worse than I felt already. And he said, well, do you want to be put to sleep? And I said, no, I want to know what's going on. So I said, just, if you can flip me over, you drill, go for it. So they extracted it, and they said, and I think Dr. McGurk can better explain it, biopsy doesn't give you the answer right away. But they said, we really think you have leukemia, but we don't treat it here. We can send you to St. Luke's South. Now, I mean, St. Luke's on the Plaza, and I said, well, if you're going to put me back in that EMT, take me to KU Medical Center. And I have to admit, I knew that you had been designated as cancer research and stuff, because I had done a number of things for KU since I retired. I had spoken in 2019 at their leadership series, and I had done a presentation at the nursing schools and a number of panel discussions for your Trans Health Clinic. So I've been engaged. So I said, at least I know the place, because I never really, other than hip replacements, I've just kind of got through life. And so I went to KU, and by the time I got to KU, when I got wheeled up to the bone marrow transplant ward, I felt so, sorry, it's emotional. If you can feel at home, I felt at home. A room was ready for me, and I had no idea whether I'd be in a ward, a room, whatever. But I immediately was put into the, I guess you guys call them a ward, you know what I mean? And they had explained to me on the way down, it's a, you know, secure place, and, you know, it's, so they took me up, and then my only concern was, because being a transgender woman, you get worried about all medical care, to be perfectly honest with you. And so I got put in my room. My wife followed me, and they came in and started addressing what was in my face and checking to see if they'd gotten it at least put to get back together, and putting ice on it, and what can they do, and took their own blood tests. And then that night, Dr. McGurk comes in, or late in the day, I don't track hours. I mean, I had leukemia, and I had no idea what it meant, other than I knew it was a cancer, and it was a blood cancer, and it was not good. So he came in, and he said, I want to do my own bone biopsy. And I'm going, I got drilled this morning, and it was painful. I said, do I have to do it again? And he said, yes, I want my own. And so we got another bone biopsy done, and within the next 24 or 48 hours, it's not all clear, because it all becomes a blur. And then he came in, and he says, you have AML, but the biggest thing that helped me was he built a road map on the wall. It helped me get a picture, because that's how I think of things, in an orderly fashion. And I'm very much a planner. So, and he laid it out, number of days, number of weeks, almost to a 3-month ordeal. And I'm going, phew, 3 months I'm going to be here? I'm going, of course, he said, well, you know, we discussed a little bit, and he can better tell you. He says, well, we're not sure whether you'll survive, you know. That's the way I interpreted it, you know. And that was okay. I liked being told. I told my athletes exactly the way it was. And that's one of the things they respected about me, was we discussed our plan, and they knew everything that was coming at them. And so that's what I can tell you. I'll let you go to him.
Dr. McGurk, what clinical signs showed you that this cancer was advanced when you first met Coach Malone?
You know, the degree of bone marrow involvement, the degree of blood involvement, the leukemic cells are spread throughout the body, patient's physical condition at their presentation. So many patients will present with a serious infection, life-threatening infection. Bleeding complications are common, and Coach Malone bled excessively from that fall. So that's not atypical, and you have to worry if they're bleeding in their brain, if they're bleeding out externally. Malaise and fatigue. You know, acute leukemia, acute myeloid leukemia usually comes on like a thunderstorm on a clear day in Kansas. All of a sudden it's here, boom, and a severe thunderstorm. And that's most commonly how acute myeloid leukemia appears. And generally in days to a couple weeks, and patients without treatment would succumb, die from it. There's another route, it's a lesser common route, and that is it smolders over time. And Coach Malone had that latter pathway where the acute leukemia is coming on and over a couple of months. So it's a little bit of a misnomer, almost a subacute presentation, and then and something's not right, and you're waiting for a doctor's appointment. It's 8 to 10 weeks. Most acute leukemia patients could never wait 8 to 10 weeks without having a disastrous outcome. And Coach almost got to a disastrous outcome, as she just described to us. And so it's always medical urgency and often a medical emergency.
So explain that roadmap that you showed Veronica, literally on that wall.
Yes.
Because, and what's normally the first line of defense? I mean, again, you're kind of up against time. It's very aggressive. So what were you trying to explain to her about, like, what the steps were going to be? Absolutely.
As she described, admission to a specialized unit with HEPA filtration. And I'll just remark, patients treated at National Cancer Institute designated comprehensive cancer centers have a 50% better survival than patients treated in community hospitals. And acute leukemia really should always in this nation be treated at such a center, because a whole team, doctors, nurses, team psychologists, built around just acute leukemia and bone marrow transplantations. Critically important. Patients come in. The reason we insisted on a repeat bone marrow biopsy is many of the diagnostic molecular tests that we do and genetic tests on these bone marrows are simply not available out of community hospitals in a place where another bone marrow would be done. And we have to have that. It's essential, and it drives our recommendations and prognosis for the patient. Then we talk about, okay, what's the prognosis? And Coach was not in good shape. Coach didn't look like Coach does right now today at that presentation, and we were worried, very fragile. Were we going to be able to get Coach through it? Talk about intensive chemotherapy, which exacts a toll on patients under the best of circumstances, and those who are frail even more so. And then keeping Coach from having a serious bleeding complication, giving transfusions, antibiotics for infections which are inevitable, occur 100% of the time in our patients after these therapies. In a month in the hospital, if all goes well.
I have to ask you, because I know you're getting to work when you meet your patient about a plan, and you've got to get these patients better, but you're also having that tough conversation of getting your affairs in order. I mean,
Absolutely.
That stood out to me when I first sat down with Veronica, and I thought, gosh, that must, and of course I know you, and I'm thinking, God, how does Dr. McGurk have those kind of conversations with patients? What are those conversations like for you, just personally? I mean, when you take the doctor part out of it, I mean, what are those like for you?
They're always very difficult. The teaching in medicine is that you have to be removed and impartial. That's not possible. You are involved, and you look at this is my sister, my brother, my child, my parent, and treat them like you would treat your own family member, and patients respect that enormously. And you really have to do that, but you have to stay objective and be careful, and you must be honest. We're ethically, morally obligated to be honest and straightforward with our patients so they know exactly what they're dealing with. And you are obligated to educate them so they can make informed choices, and they understand fully, and their family understands risk benefits of moving forward or not moving forward in some cases. And that's how patients can make informed decisions. And they have every right in the world to know. In medicine, all too often, historically, we have been rightfully accused of not being in the field, of not being straightforward, and patients not clearly knowing what they are confronted with. That's not right. That's not how we roll at KU in our program. We tell it like it is, with understanding and compassion, and then what can we do about it?
Yeah, and then you have everything to work with, and Veronica said how much she appreciated that you know, that's how she rolled with her athletes, and
Yes,
that's how she
absolutely.
wanted it. Dr. Monks, I want to bring you in because you were such a vital part of Veronica's treatment plan as well. How do you approach the mental health conversation with a patient who's critically ill? Their survival isn't guaranteed. I mean, what are those first initial conversations like?
Yeah, I think it's important to really get to know the patient, because every patient comes with strengths to capitalize on, especially athletes who I think come with a lot of built-in skills and resiliency, like I said, and grit that they can really use and apply to their journey. And everyone comes with whatever they come with, whether that's previous experiences. It could be their faith, it could be an exercise routine, it could be incredible family support. So really getting to know the person that's in front of you is kind of the first step, because you're gonna really take what they come with and what they bring to the table and build on that to really help them get through. I always say that tears are an important part of the process, because I think of it as emotional sweat because everyone is working so hard emotionally that you can't not sweat when you're doing all of that work. So I really just try to meet patients wherever they are, and then go from there, and help patients understand that health is health, and that there will hopefully be a day that we don't really parse out physical health from mental health, and it will just be health, because the mind and body are intertwined.
Absolutely.
And so helping patients understand, like, there's a psychologist on this team for a reason, because we value taking care of the person as a whole.
Veronica admitted there are times she didn't want to wake up. When a patient tells you something like that and is open, and thank goodness they're open like that.
Right.
How are you to respond to something like that?
Yeah.
Where do you take it from there?
I usually say, I bet. I can understand that there are times when you don't want to get up, and there are times when it feels unimaginably hard, and probably a lot of ways that people around you cannot understand that, because we're not in our patients' shoes. And it's also our job to coach, right? To figure out, and you got to get going, right?
Yeah.
I am a big proponent of both, and that you can do kind of two things and feel multiple things at once. You can be hopeful and hopeless. You can not want to get up and get up. That you can kind of do these things at the same time. So I think it's really important to validate wherever a patient is, and then say, okay, you can be there right now, and it makes a lot of sense why you're there, and then let's figure out how we're going to move forward.
As an expert coach, were you properly coached?
Yes, I was, because I'm not a very good patient, I'm sure. That would be the classification. Just because I didn't fear death, and I have taught taking ownership. In fact, my reminder to myself and a couple, when I retired and I transitioned, and then this, it was about owning my own black line. And I coach in the sport of swimming, where people ask me, how do they do that, going up and down that pool every day for unbelievable number of hours, unbelievable number of days? Because my top athletes in my elite group were training between 30, 40 hours a week, besides going to school, because they're mostly high school students. And, and I said, well, they do, first place, they put in about 30 hours just driving back and forth to practice, because they have a distance to get there. And I said, I can at least do this. And that was part of my ownership. And trying to be as tough as I expected them to be.
I love that. I love that. Those tables kind of turning. Dr. McGurk, let's talk about because I want to talk about the bone marrow transplant, because Veronica needed to be well enough to receive one and to stabilize. What made her a good candidate for that? When was she able to get one? And then how did you go about finding a donor? And were there any challenges with that?
She went into remission with chemotherapy, which is an absolute prerequisite, but not curative. So the only chance that we were going to cure Coach Malone's leukemia was through a bone marrow transplant. But as mentioned, when Coach Malone first presented, she was really quite frail. We leveraged exactly what Dr. Monks and Coach Malone have been talking about. Once I understood that Coach Malone was the person, and actually there had been a lot of talk behind the scenes saying, do you know who that is? And so I quickly did my Google work and such and figured out who that was, and it was like, yeah, we're going to use this. We're going to leverage this information. We're going to coach the coach. And that's exactly what we did. We coached the coach, and Coach Malone made progress and got to the point where we felt statistically we could safely go into a bone marrow transplant. Still many risks and many dangers around the corner, but we thought that we could do it. Always believed in Coach Malone. Coach Malone's attitude and determination is what got her here today. However, our leveraging, understanding who Coach Malone was critical to that effort.
So you had to learn a little bit about the patient.
Absolutely.
And how to manage the patient.
That's exactly right. And we have meetings where Dr. Monks is feeding us information and saying this is where this person's coming from, and
like
and
a full-on operation.
That's right, making sure that we're well informed before we have crucial conversations with
Dr.
patients.
Monks giving you the intel, the
Yes.
important intel. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is on your screen. Veronica, Coach, how long has it been since the transplant?
Well, I'll be honest with you, I've never lost track of time, but I have lost track of time. I think I'm approaching my second year, which will be this April. As Dr. McGurk explained to me, April 4th was my new birthday. Mm-hmm. And so now it's, because I've been living holiday to holiday or birthday to birthday for 9 grandchildren and my wife, you know, or an anniversary, you know, I've just kind of focused on that. Whereas I used to understand exactly what month, what day of the week, where you were at, because I was famous for what I called my 4-year plan. So his plan made sense to me because that's how I ran my program, you know. It was from Olympic to Olympic, you know, and you start where you want to end and you come backwards, and then you walk the path. So it made total sense to me. So I was a somewhat compliant patient. I'm sure a difficult one because I didn't like being cooped up, and it was a little shocking. I had never been, ever since I left home, because I left home when I was about 16, and that's when I felt pretty horrible. And then I haven't felt like that since.
And now you're just taking it day to day? Are you living life differently? How are you living life differently?
Well, I'm trying to get back to where I feel like I can plan and live forward. Because that's how I've lived life. I don't spend much, people say how many Olympians you have or what have you, national records or American. I don't know that stuff. They were results that, like with his patients, they succeeded and you move on to the next one. And that's how I've coached and lived. So reflecting backwards is not natural for me. Other than immediately after I finish something, I look back, what I did right, what I did wrong, what did I learn, and then I go forward. And I think that was my strength to getting through this.
Yeah, that's an interesting lesson for all of us. Mm-hmm. On that note, Dr. Monks, a lot of patients have the possibility of a relapse, mm-hmm. you know, in their mind. How do you help patients through that? You know, some type of setback. Mm-hmm. How do you help them?
I mean, I think
move forward and stay looking forward.
Veronica has the exact, I think, right approach and sort of algorithm, I think, which is attempting to try to be as present focused as possible. I think that's easier said than done because fear of recurrence is a very real worry that every every patient that cancer touches has. It's kind of like a cloud that just hangs over you.
Yeah.
And I always say, but the sun is still out, and some days you can see it, and some days you can't, and some days are harder than others. But this approach of trying to be present and trying to be mindful, I think, is what we try to encourage, and then getting to a place where you can start looking forward. Because our patients do so much work to get to a place where they've got their cancer in remission, under control. Yeah. I'm always thinking, after a stem cell transplant, you have earned this. You have sacrificed so much to get here. I want you to enjoy what you've earned and not let that fear of recurrence hamper you too much.
Yeah, and I like that, because when I spoke with you originally, it was this, I'm just trying to get through each day today, and that idea of getting back to, I want to start looking year to year again, you know, getting back to how you used to be. I am going to ask you, though, to go back a little bit, you know, like 5 decades, just very quickly. Yeah. 5 decades when you co-founded the Kansas City Blazers.
Yes,
cancer is not going to be your legacy, my friend. This is your legacy. I'm sorry, but this is your legacy. You started the Kansas City Blazers 50 years ago. Right here, these 2 coaches, if you'll hold on this right here, these 2 coaches actually coach my children. So right. you are setting the standard for swimmers decades to come. So tell us a little bit about the Kansas City Blazers.
Kansas City Blazers, I came here to Kansas City in 1974-75 to start the program. We just celebrated a 50th anniversary of the club. I've been retired since 2010-11, and so it's under new leadership and new everything else, but the club lives on. That's the most important thing. And because part of our motto was the eternal, which our logo is a half sun, which came from when I first moved here. I had never seen blue skies like you see in the Flint Hills. I lived in Toledo, Ohio, which is on Lake Erie, and it's just clouds and dreary. And to come here and see cloudless skies and deep blue was heaven.
Well, thank you for all that you've done. And just inspiring young kids for 5 decades. It's really incredible. It's really incredible. I want to get to a couple quick questions from our audience if I can. And just one great comment from Ruth. Ruth says, what a brave individual. Thank you for telling your story on so many levels.
Thank you.
Jeremy has a question. When I think about cancer, I usually think of it like a place, a tumor or area, and that's where the cancer is. But with a blood cancer like this, how does that work? Is there still a kind of home that the cancer is focused on, or is it just kind of everywhere throughout the body? And how does that change what you do with it?
It's both. So its home, where it derives, is the bone marrow. And we have bone marrow throughout all of our long bones, our ribs, our skull. And oftentimes, as was the case for Coach Malone, when patients present, they will present with bone pain and confuse it, for example, in Coach's case for possibly I've got a spinal process going on or such, because the spine is very rich in bone marrow. But the cancer cells, the leukemia cells, don't stay in the bone marrow. The bone marrow generates all the blood elements. And so the cancer cells, too, just like blood cells, are moving out of the bone marrow into the bloodstream in every tissue in the body. So the leukemia is everywhere, essentially. And so you have to treat the patient in a way that's going to get a therapy effectively everywhere in the body and not just zoned in on one specific place.
Dr. Monks, I'm going to let you get us started on what do you want the big takeaway to be from our conversation today?
Well, legacy, I think, is a big theme for today, that cancer does affect everyone, and I think also it's important to realize that people are much more beyond their cancer. And that's why it's so important for us to get to know our patients, because not only does what every person bring to the table, not only does that help them get through the process, but recognizing that each person is so much more beyond their cancer. That's important, but I think also helps them stay motivated for getting through and getting past it. So I think that's really important, and also just recognizing that taking care of like the whole person is an incredibly important part of what we all do here at the Cancer Center.
Thank you for what you do. Coach Malone, what do you want the big takeaway from your story to be?
Perseverance in life's every day is a treasure. And so don't expect it, enjoy it, and realize that tomorrow's not guaranteed. So, and realize that the world that's there to support us is huge, and allow them to help. I couldn't have done it without them. They believed in me, and it was easy to believe in them, because they came to the table with a plan, and they came to the table with answers. Sometimes I didn't like them. But information is a treasure, and it's what you do with it. So I say thank you to KU Medical Center, Dr. McGurk and his research, and his team, and Dr. Monks with their emotional support, and with you for taking the time to still tell the story. I wish, because as much as I'm frustrated sometimes, because I don't still walk very good, and if I have to walk very far, I have to use a walker. And that's, none of those things are part of my MO, but they are now. And I had to learn to be proud of it. So putting the walker in the back of each of the cars we own, we have one in each car, so whatever car we take, if it's going to be more than a short distance, I have to use it just for safety. And I'm just blessed that I have this opportunity to watch my grandchildren grow up. Hopefully I make sense. I'm sorry.
You make a lot of sense. And we're so lucky to have you here with us today, and we're just so happy that you wanted to share your story with us. And Dr. McGurk, thank you for introducing us to Coach Malone.
Yes, of course. It's a pleasure.
What do you want the takeaway to be from this story?
I think getting the message out to patients about perseverance and what Coach Malone just spoke to is critically important. I think it's also critically important to understand that we are absolutely in a revolution in cancer therapeutics right now. We're seeing cures in patients who had absolutely no chance of being cured 5 and 10 years ago. It's an extraordinary time. Coach did relapse after the bone marrow transplant. That wasn't mentioned. And we identified a specific genetic mutation in our cancer center that we found a targeted drug for, gave to Coach, put Coach back in complete remission, and Coach remains in complete remission today. Prognosis is very good. That kind of scientific effort and undertaking is critically important, and oftentimes only available in an NCI comprehensive cancer center like our own cancer center. I would say to the audience what I would say to my own family member if they were sitting here with me today. and they had a serious life-threatening disorder like cancer and certainly a leukemia, is get to the best place you possibly can. Do your homework, do it quickly, and go where there is a team who are completely focused on your specific disease and are on cutting edge in doing research like our own center. Outcomes are significantly better.
Dr. McGurk, thank you so much for all the work you do. Thank you all for being with us today.
Thank you.
Thank you, Joyce.
Great conversation. Thank you to our guests. Thank you to our audience for being with us, and we will see you back here tomorrow. When you sleep, your body and your brain rest and repair themselves. But for Eli Meese, sleep was something he dreaded. I'm Alexis Del Cid. On the next All Things Brain Health, learn why bedtime marked the most terrifying part of his day and how doctors fixed his problem. Tuesday at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.